All right, guys. So today we're going to be breaking down a real USMLE question from the TrueLearn Step 2 and Shelf Bank. And the goals of doing this today are really going to be to show you my basic process for how I get started with a question and how doing that's going to really set me up for success. So we're going to really focus on where I start out in the question, how I'm using the answer choices for a guide, and you'll get to see how that can really impact as you move forward through the STEM. So for me, I'm a big fan of starting at the very end first. I've said before that really just gives me a snapshot and a preview of what's going on in that question. So I like looking at that last sentence. And then I also like looking at the answer choices as a little bit of a guide. So here we see that we're being asked, this patient's laboratory findings are most concerning for which of the following. So I know I need to look at some abnormal lab findings and kind of try to piece together where that's going to go. And with the exception of maybe one answer choice, answer A, talking about a medication adverse effect, I noticed that by looking at my answers, they can kind of group out into being hepatobiliary diseases, B and C, versus more bone disease. So what I might be thinking about here is, why would you be testing these things against each other, especially with regards to laboratory findings? What's something that maybe comes to mind for me there that might be a link between the two? And I'm going to be thinking about how that can influence, processing any other details through the question stem. Now, if you want to take a second and pause right here on the recording so you can actually go and read the stem on your own, I'm going to give you a chance to do that. And then we can jump right back in. So pause if you want. All right, now we're going to come right back to it, and I'll show you guys the key details that I want to focus on here. So again, we're going into this STEM with the goal of trying to figure out what the abnormal laboratory finding or findings are, linking that to one of these answer choices, and maybe trying to figure out, is this going to be more of a bone process or hepatobiliary? And we know what those answers are. So that's going to really influence what variables we want to focus in on here. So if you're looking up at the STEM, there's not a lot of significant details up there. I think really the big key takeaway is it's a 71-year-old male coming in for a health maintenance examination, and he feels fine. We're not seeing any significant risk factors. We're not seeing any significant symptoms. He doesn't have any abnormal examination findings. So I know that this question is really going to hinge mostly on an asymptomatic laboratory abnormality. So thinking through that as I go, hemoglobin is normal, leukocyte count is normal, platelet count is normal. I'm not keying in on any of that because it doesn't really reflect too many of my answer choices. I might highlight that the hemoglobin is normal just because that lack of anemia is really going to make multiple myeloma less likely. Moving through the next details, sodium normal, potassium normal. Again, that normal creatinine is really helpful for me because that, again, is further making multiple myeloma less likely. Seeing that the calcium is normal here, again, that's a normal lab finding, but it's very helpful because it tells me that maybe primary hyperparathyroidism is not going to be very likely. And then as I get down here to my LFTs, what I notice is that the only significant abnormality is this elevated alk phos. So when I get to the end of a question, I'm always going to try to convert it into the most direct thing possible. And here I'm really saying an asymptomatic, isolated elevation in alk phos is most concerning for which of the following diagnoses. And again, you can pause here if you want to think through this a bit on your own. Maybe you know the answer. Maybe you need to do process of elimination. So take a second to pause if you want. And then we can come right back to it and start thinking about each one. So let's pretend that we just didn't know the answer for this right away. Or even if you do, I think using process of elimination is really helpful for double checking your work. So as I move through this question, we'll first stop on the statin. I know that a statin can give me LFT abnormalities. However, he's been on the medication for 5 years, makes it a little bit less likely, at least on the test. And then we want to think about what those LFT abnormalities actually would be. And if we're thinking about a statin, what we're really thinking about is more of a hepatocellular injury pattern. So rather than seeing that isolated bump in alk phos, I would be expecting to see more of a bump in my AST and ALT. So we kind of know that that's going to be wrong. Then we can think about cholangiocarcinoma. And while I know that can give me a cholestatic process, that would not appear as only an isolated elevation in alk phos. I would expect to see hyperbilirubinemia with that, namely conjugated hyperbilirubinemia. So the fact that that's not there really tells me that this alk phos elevation is not going to be coming from a hepatobiliary process. And if there were other answers on there, PBC, PSC, a tumor in the head of the pancreas, I would be able to get rid of those as well, because I would have expected to see the bilirubin elevated too. Moving into our next answer with chronic viral hepatitis, a few reasons I can pick out right away that that's wrong. I don't see any risk factors here. And then again, I would not be expecting just this isolated elevation in alk phos. I would want to be seeing the aminotransferases elevated more. I would maybe want to be seeing hepatic function compromised to some extent, so the bilirubin would be elevated. So at this point, we've really narrowed this down that it's going to be a bone issue. And if we think back to what I just said, as we were reading this, because we knew what our answer choices were, we've already done a lot of the work. We know multiple myeloma could give us an elevated alk phos, but we would be expecting to see hypercalcemia in there, an elevated creatinine from renal insufficiency, anemia. With none of that there, it makes that very unlikely. And then thinking about primary hyperparathyroidism, if this were the issue, what we would be expecting to see is, again, hypercalcemia going along with that elevated alk phos, as well as a low phos from PTH causing increased renal secretion of phos. So we're really at this point, I would say we felt very good that we could eliminate all of the other answer choices. And sometimes that might honestly be the best thing that you can do, is say, I know why 5 or 6 of them are wrong, and I'm just left with one, and that's going to be what I would go with. But just to make sure that we are really hitting this knowledge point as well, one thing we know with Paget's disease of the bone is going to be that really, while question stems tend to focus a lot on the symptoms that you see, the bone pain, the headache, the hats that don't fit, the hearing loss, most patients with Paget's disease of the bone are actually asymptomatic, and they get diagnosed based on an elevated level of alk phos that's discovered incidentally. And that's really coming from the fact that with Paget's disease, you have osteoclast dysfunction that's driving increased bone turnover and disordered bone remodeling. And what I might want to do here to really quiz myself is think about maybe some next directions that the question could have went. What would I be doing next? Well, I could be going and looking for some of these markers of bone turnover in the urine. I could be doing X-ray and bone scan to try to really definitively confirm that diagnosis and make sure that I feel good. So there's a little insight into how I break down a question, why it's helpful to start at the end, why it's helpful to look at the answer choices, and how that can really impact your ability to actively think through a question as you go through it. So I hope that helped, and be on the lookout for more of these videos.